I'm a pediatric cardiology fellow, and here's what my first year was really like. When I started, I wish I had someone to break down exactly what to expect. There's so much to cover, and I'm going to break down how my program is structured, the different types of rotations, research requirements, call schedules, and more. So if you're considering cardiology, I hope this insider look will help you determine if it's the right path for you. So let me give you a little bit of background. When I was in my postbac, I went on a mission trip to Ecuador, and that's where my interest for cardiology first began. We were serving in an underprivileged population of people, and I diagnosed my first pediatric heart condition, which was a dilated cardiomyopathy in an 8-year-old boy. So being able to help children like him thrive lit up my curiosity and passion for the field. Later, as a med-peds resident, I had exposure to patients of all ages. And during my adult medicine rotations, I managed a lot of coronary artery disease, hypertension, and heart failure. And though I appreciated the medical management, I found myself losing interest because the practice felt a little repetitive. And on the other hand, my pediatric cardiology rotation was more intellectually stimulating, and ultimately I realized that pediatric cardiology would allow me to care for children and also prepare to care for adults with congenital heart disease later in my career. And it was the perfect fit for me. For me, every step in training was harder and more stressful than the step before it. So one significant shift from residency was the difference in the work-life balance. In residency, I worked long hours, but once I returned home, I felt like I could truly disconnect from work. Whereas in fellowship, breaks are far and few in between. And even after completing my daily responsibilities, there was often additional work to be done in the evenings. So it was more demanding in terms of the workload and the time spent in the hospital compared to any year of my residency. I try really hard to separate my work and home life, but there are times when it just becomes impossible, and I just have to adapt to that situation. And this is why I commit long hours to my work during the week so that on the weekends I can fully devote myself to my husband and my dog. Surprisingly, I have not experienced the same level of burnout in fellowship as I did during residency. This is mainly because I had already established an effective work routine that carried into my fellowship. Overall, the fellowship experience has been more rewarding than the residency because even though I'm more busy at work, it's with work that I'm passionate about rather than rotating through different specialties, caring for patients and conditions that maybe weren't as interesting to me. And then from a financial perspective, my income did decrease from the end of my residency, where I was making nearly $68,000 to now about $64,000 in fellowship. But essentially, I'm living on a resident salary in fellowship. So I think it's important to just consider all the financial aspects when you're deciding to pursue a fellowship, because you are basically giving up 3 years of an attending physician's salary. I'll never forget the day I got a call from my program director congratulating me for matching into our program. And in my excitement, I asked her, what should I start studying or reviewing before day one? So when I get there, I hit the ground running, but she bluntly just said, nothing. That's what fellowship is for. Just go out and live your life. And at first I was taken back a little, but then I realized she's right, because there's no amount of pre-reading that can fully prepare you for fellowship. And at the beginning, I was very eager. And despite finishing a rigorous residency, I had minimal cardiology experience with children, and I was getting calls for very complex patients. So the learning curve was steep and it was a slow trek up. But looking back, the best way to prepare is to be ready to take your boards as early as possible. Getting this out of the way at the beginning of your fellowship will allow you to focus 100% on fellowship, which will be to your advantage. First year fellowship kicked off with month-long orientation focused on learning echo. I felt like a wide-eyed student on the first day of school being shown the ropes by my senior fellows and sonographers. I felt extremely lucky to have great sonographers as instructors that really challenged me to think like, okay, what am I doing right and what can I improve on? And then after my orientation and my crash course, then I hit the ground running by being the primary provider for all of the cardiac kids on our cardiac step-down unit. And a lot of them were post-op patients and were not quite ICU level of care anymore, but they still needed to work on healing, feeding, growing, and basically just fine-tuning their medications. And this was by far my busiest rotation because as the fellow, you're also responsible for the consults that come from other units like the PICU, NICU, emergency department, newborn, and so on. But first year exposes you to all of the subspecialty. So there's electrophysiology, heart failure, interventional cardiology, non-invasive imaging, inpatient cardiology, cardiac ICU, and adult congenital heart disease. Some of the typical consults I saw in my first year were cases of syncope, chest pain, abnormal EKG, low oxygen sats, and lots of preemies with PDA. And then our primary service felt like it was more about diagnosing new congenital heart defects, managing our established patients that were in for more general pediatric issues, overseeing the post-cath and EP cases, and of course the post-op patients. When it comes to procedures, echo is technically a procedure, so that is the number one thing you have to master. One thing that is different about my program from what I've gathered talking to other trainees is that we are first call on the weekends for echocardiograms. So this means that if any patient in the hospital needs an echo, we are responsible for obtaining the imaging because we do not have sonographers covering the weekends. So if I had to summarize it in a snapshot, it kind of looked like this. So the call is very different from program to program. But in my program, we take home call, so I don't have to be in the hospital all night. Fellows share calls throughout the week and the weekend, so on average, I'll take a weeknight call maybe 3 to 4 times per month, and then one weekend call every 4 to 6 weeks. So sometimes I have to go back to the hospital for something urgent like an echo or an admission. And then we also take what we call mommy calls. So our patients can be very fragile, especially those that are in our interstage or high monitoring program. So our cardiology office gives out our number so that parents can contact us if they have concerns about their babies, basically. If you thought residency conferences were intense, fellowship takes it to the next level. One of the most nerve-wracking aspects of fellowship was the biweekly case conferences. Conferences are these fellow-led meetings where our entire heart center team comes to hear about the surgical and cath cases that we have scheduled for that week. And in my first year, I typically presented 1 to 2 conferences per month, and we'd get a list of patients that needed to be discussed and then a list of patients that were already scheduled for a procedure. And as a fellow, I was responsible for gathering the patient's history and then presenting all of the imaging. This is difficult for me last year because I was not used to reading cardiac CT or MRI. So in addition to that, we have to review the cath data and the angiograms. So for one case, you could be presenting various imaging modalities, and it's your job to know the heart inside and out by integrating all of this different data that the imaging is giving you. So this is very time consuming, and on average, I was spending 3 to 4 days to prepare. And typically we present 1 to 2 conferences per month. So you present to a room full of cardiologists and surgeons, and it can be pretty intimidating because in the beginning, I didn't know all the pertinent things that were relating to my patient's condition. So I get asked these questions that I didn't know, but this was also the time where I felt like I learned the most because it sort of cemented that in my mind, it was important for that sort of case or pathology. The weekly caseload varies, but the max number I had to present in my first year was about 10 patients for just one conference. To survive these conferences, I learned to over-prepare, and one of my seniors literally called me an over-preparer because I meticulously reviewed the images and met with my attending attendings before the conference if I had any doubt. And many extra hours went into prepping, but it paid off by building my confidence. In my first year, fellows are expected to identify a research interest and then to develop a research proposal. I'm almost to the halfway point of my second year, which is crazy because time is flying, and I know that third year will be here before I know it. And in my third year, I will have a large chunk of time dedicated to finishing my research project. The thing about pediatric cardiology is that not one size fits all necessarily. It's not like internal medicine where like you have something like pneumonia and then I give you an antibiotic and some oxygen and then you get better and that's it. In pediatric cardiology, you can have something like a double outlet right ventricle patient and their history and their repair will be different than your next door patient because of their specific physiology. So I'm at the point where I feel like I can pick up on these little nuances and create a plan to best help my patient depending on their current physiologic state. So if you stuck it out to the end, thank you guys so much for listening. As we speak, I'm currently about 4 months into my second year of fellowship, and it's flying by even faster than the first. Coming up soon is an elective where I will learn transesophageal echo, and I'm a little nervous about that, but I'm also excited to add this skill to my toolbox. So I plan to keep sharing my ongoing journey of becoming a pediatric cardiologist, and if you're interested in following along, please hit that subscribe button. Thanks so much for watching, and I'll see you next time. Bye-bye.